Hello, my name is Dr. Sujay Chandran. I'm a consultant interventional cardiologist practicing at Kingston and St Thomas's NHS Foundation Trust. I'm here today to talk to you about what a coronary angiogram is and subsequently what a coronary angioplasty involves. So if a patient's presenting with chest pain for which we want to exclude narrowings or blockages in their heart arteries, we can undertake a coronary angiogram. The coronary angiogram is an invasive test where we put a tube either in the artery in the wrist or the artery in the groin, through which we can then pass long, thin tubes which curve up towards your heart, and then we inject some contrast, which we can then visualize on our x-rays to see if there are any narrowings or blockages in the heart arteries which could be causing the symptoms of chest pain. We're usually able to let the patient know the result pretty much on the table or immediately after the procedure. For doing a coronary angiogram, the procedure usually lasts up between 5 to 10 minutes. And apart from giving some local anesthetic at the outset and some mild sedation, there's no serious risks from the procedure, although we do quote a 1 in 2,000 risk of complications such as heart attack and stroke just from doing the procedure. So this leads on to a coronary angioplasty, which is if we do find a narrowing or we're set up or we've already identified a narrowing and we want to treat that narrowing or blockage with a balloon or stent. So similarly through the wrist or the groin, after having put a tube in the wrist, for example, we then use slightly bigger tubes which curve up towards the heart, and after identifying where we want to treat and which artery we're trying to treat, we use a wire which passes through the narrowing, and then over that wire we inflate a balloon which expands the narrowing, and then using a tiny metallic structure called a stent, which is crimped on a balloon, we expand that, and that leaves that stent in place, keeping the artery open and prevents it narrowing off immediately. The risks are slightly higher, but still very low. We quote risks about 1 in 200 of serious complications, such as heart attack or stroke, from just doing the procedure. Now, it's a common question that I'm asked, but usually the patient is awake and it doesn't involve anything invasive where the chest is cut open. And reassuringly, most patients can either go home the same day from an angioplasty, or worst case, usually the following day. So in summary, these procedures are safe, and particularly with respect to an angioplasty, patients can usually go home the same day or the next day, and the recovery time is very quick. And then I'll always follow patients up when they've had either of these procedures, see how they're getting along, and they're usually able to get back to their usual activities and work within a day and maximally up to a week.